Hello, Colonel Patrick Pohle here from the 21st Medical Group. Welcome to this week's rendition of Medical Minutes. What I'd like to speak about today are medical group training days and how those impact patient care. I am often asked about medical group training days. In other words, when and why do we cancel patients for 1 day per month? Well, first of all, let me explain the when. The second Thursday of every month is the medical group's training day. This is typical for most months with a few exceptions. For example, in the month of November, we know that we have multiple holidays. Because we are missing out on opportunities for patient care, we've elected not to have a training day in November and instead tried to catch up on that training come our December timeframe. So that's the when. Second Thursday of every month. And by the way, that's consistent with the rest of the local military market. But here's the why. Why would we have to shut down clinic operations to make sure we have a separate training day? Well, the medics basically have two missions. One is the delivery of the healthcare benefit to our beneficiaries. That's what most of you are used to because that's what you see every day. For example, primary care. If you have what you think might be a sinus infection, you come to see us. That's delivery of the healthcare benefit. By doing that, we're able to build currency for our members. And there's a little bit of overlap with the second part of our mission, which is readiness. Part of my responsibility is to make sure that our active duty medics are ready to deploy when called upon to do so. However, if we just focus on the healthcare benefit, we're unable to train on the things that are really more specific to deployment and all hazards response. For example, seeing patients in clinic does not necessarily prepare them in terms of how to respond to a chemical weapon attack. How do you do that? Well, we need those training days to make sure that our people are prepared and ready to go for just such events. So again, two sides to our mission. If we only focus on the healthcare benefit and we don't take those days, 1 day a month, in order to focus on the readiness piece, then we're missing out on a large part of what we're asked to do. Okay, so I hope that helps explain a little bit about the when and the why of the medical group training days. As always, thank you for joining us for this week's Medical Minutes. Good health and thank you.